tell us a little bit about what we need to be doing as citizens when we find out we have catastrophic illnesses in our families to keep them from from losing homes, property, and so on? Is there something we can do to make sure that doesn't happen?
That is a tough question. I need to call the probate judge to help get that answer. I guess before I start, I got to recognize Ms. Betty Henderson, the chairman of the Orangeburg County Democratic Party. She's like a second mother to me, so Ms. Betty's here. And also Bill Connor came earlier, and he's running for lieutenant governor. He didn't have to come, but I think it means a lot that he showed up. So I did want to recognize those two people. You did give me the toughest question out there, so I'm probably going to do like most politicians do and deflect and answer a question I know the answer to. I think healthcare reform is a very large issue. As Jerry Govan, who's one of my heroes who I get to serve with, which is truly a blessing, gave the numbers between 38 and 48 million, and even my colleagues to the left of me today, but to the right of me on most issues, have stressed. I think we all agree that healthcare reform and the need for reform in our insurance industry is very important. But to go to a larger point, and Mr. Omer talked about competition, and one of the things that the Obama administration is trying to do is build in exchange systems within states whereby we have a market where these insurance companies can compete. And when you have this competition, it's very true that prices will go down. For example, Blue Cross Blue Shield of South Carolina, they have the highest surplus of any, surplus means extra money after you pay all your debts. They have the highest surplus of any Blue Cross Blue Shield in the country, right here in South Carolina. They own 2 private jets. They cover 2.7 million of the 4.2 million South Carolinians we have in the state. They have a huge stranglehold on what goes on. And they have buckets of money over there, and I think that's a problem. When my Aunt Jenny Marie passed away and she was making the decisions about her utility bills or her prescription drug bills, and talking to you all is a little bit different than talking in Columbia because you all understand what that means. I mean, some of you all out there are having to make those same type of decisions. And to go back to the probate issue that you talked about when you have catastrophic injuries and things like that, and one way we can prevent those diseases and industries from occurring is if we do something that not the president's trying to do, but the First Lady's trying to do. And that's talk about prevention. Especially in the African American community, we haven't done enough to talk about prevention. So I think if we talk about things like childhood obesity, which leads to cardiovascular disease and diabetes, this is something that you and I, we can all agree on. This is an idea on how to rein in costs. Because obesity and childhood obesity, when these kids get diabetes, when they have cardiovascular disease and heart failure, this costs the average American about $500 because many of them don't have family practitioners. They go to the emergency room when they get sick. So before we get to catastrophic diseases, because I'm not sure how to handle the probate issue, I'll be honest with you. If anybody's having a probate issue, find me and I'll try to get those answers. But I can tell you that the answer to the problem before we get there is that we talk about prevention. And I think that's very important.